And joining us now to help separate some of the fact from fiction when it comes to Obamacare and its rollout is James Knickman. He is President and Chief Executive Officer of the New York State Health Foundation. It's a private foundation dedicated to improving the health of all New Yorkers. James, nice talking to you again. Thank you.
Nice to be here.
Okay, well, we heard the president, and to paraphrase, he said there's no sugarcoating. There's been real problems as it relates to the rollout of the site, and he said nobody's more frustrated than himself. That said, how would you assess from the beginning to where we are now of Obamacare?
Well, you know, it's been a long road, and there's been so much political and public policy fighting. But since the Supreme Court ruling, you know, everybody has been, you know, full steam ahead to get ready. And I think a lot of the early rollout went well. Most of us who are working in the health sector have been very disappointed with the last few weeks. You know, just the system was not ready for prime time, and there was much more demand than was expected. But they are working away at the fixes, and I guess we'll see.
To that end, James, from people in the industry, are you getting the sense, and we can localize it if we want to the metropolitan area, New York specifically, that the glitches will get resolved here sooner than later, or are people worried that these are more systemic?
I don't think they're systemic or unfixable. Like you take New York and Connecticut are working pretty well. There's 110,000 people who have now gone through the eligibility process in New York, and the wait times are way down. It was very difficult the first week to 10 days, but they're making adjustments all the time. And so I think that's a good sign. Washington State is great, Kentucky's great. Of course, New Jersey is a federal you know, exchange, so they're the ones that are having a hard time. Is anybody who is relying on the federal government's exchange, that's been more of a problem. But I think the fact that the state-based exchanges that were on their own have figured it out would suggest that the federal government should be able to figure it out.
You know, one of the things I think that's lost among many people, James, is sure, and it's a legitimate point about the major problems with rollout, and the president, as I said, spoke to it today. But there's been a lot of demand for this, and I think that speaks to where we are as a country. You can't have 40, 50 million people, even upwards of that, uninsured in this country. It's just not sustainable. There's a reason why people want this.
Definitely, and you know, I talked to people who are running some of the Navigator programs in New York, and they say the demand is tremendous, and the enthusiasm is really strong for people who do get through and are signing up. So there are just a lot of people, and you know, people are smarter about insurance than you think, and a lot of people are realizing that the premiums that they're hearing that they'll have to pay are a lot lower than they would have gotten a year ago, especially in New York and New Jersey and Connecticut. And so they're reacting, and this is a pretty good deal.
You know, James, last week we were going through some of some of the comments in history on some of the programs, and I could lie side by side what people at the time said when LBJ rolled out Medicare, when FDR rolled out Social Security, and they're almost to the word of what some of the critics are saying about the premise of national health insurance, or something approaching it, I should say, as it relates to the Affordable Care Act. Do you think in time this program will be as popular as some of those predecessors when you're talking about, like I said, Social Security and Medicare?
Boy, it's hard to imagine that given the animosity of the two sides right now, but it surely could be. It's you know, it's going to take 5 or 10 years, I think. But, you know, I also think that we're not done. We're still going to have 20, 30 million people uninsured in this country. And so my guess is in the long run, this is a step towards what might look different, you know, 10, 20 years from now.
And is it possible to tweak it without destroying it altogether? I mean, there have been some problems, even from its supporters, that they say, I'm not just talking about the roll-up, but some elements within it, or even some elements that aren't even included in the legislation. Can this thing be tweaked without destroying, I guess, the spirit of it?
Oh, sure, it could be tweaked, and you know, as you probably know, like the Social Security program was changed about 10 times before it was actually implemented. Same thing with Medicare. Same thing with the Part D. You know, President Bush's drug benefit. So these things do get changed. Unfortunately, right now, I think there's such partisanship in Congress that it's hard to make the tweaks that normally would be made in a complicated program like this. But I think, well, it'll really depend in some ways what happens in 2016 about how this gets tweaked. But I think eventually it will. And you're right, people on both sides have issues that they don't like. And I think under normal circumstances, you could probably do deals and change things this way and that to make everybody a little bit more pleased with it.
Final question, James. Let's not go to 2016, but a little bit shorter term. You and I sit down in January of 2014. Due to the landscape of New York, do you think people will be surprised at some of the things that are available to them under this program, or do you think we're still dealing with a lot of the logistical and technical headaches that have plagued us so far?
Well, I think the logistic difficulties will be solved in New York in the next 2, 3, 4 weeks, and as I say, it's already working, pretty smoothly at this point. And I think people are going to be pleased with the options. I think nobody ever wants to pay any money, so people are going to have to pay some money, and that's difficult. But surely people who have been looking for insurance are realizing that this is a better deal. I think in the longer run, there are issues. These insurance policies are not super generous. They have deductibles, they have co-pays, and so I think that will disappoint people. They can buy policies that are really high quality, but they're more expensive. And so I think there'll be adjustments over the next couple of years as people use the policies and decide whether they bought the correct ones the first year. You'll be able to change it each year. So,
James Knickman, thank you so much for a few minutes. I appreciate it.
Thank you.